Good morning, good morning. How's everybody doing today? It's Tuesday. I'm assuming that everybody made it through Monday. We're going to talk a little bit today about, I don't know how many of you have seen this thing that seems to be blowing up all over the place. We're talking about Kendra, the lady who fell in love with her psychiatrist and her chat, Henry. Now, when she says her chat, Henry, she literally is talking about Chat GPT, whom she has named Henry, and she now consults Henry with everything. The only problem, with Henry, okay, you can with Chat GPT, and it's so detrimental. It's one of the worst things that we ever could have come up with. Especially if it's being used by someone who has any degree of mental or emotional illness, disorder, whatever. Um, you can set your chat GPT up to be honest with you and your questions, or you can also set it up to be to only give you positive feedback. And that is what this lady, it appears that she's done. Um, but just to give you a quick rundown of her little story here, she claims that she fell in love with her psychiatrist and that her psychiatrist recognized that. And instead of turning her away as a patient, took advantage of that and continued to let her come as a patient. And how she talks about how she's daydreamed about this person, and then it even goes into some emails, and she talks about how she emailed them and emailed them and emailed them, and he stopped, emailing her back, and she wanted to know why he wasn't emailing her back, and he's trying to tell her in a nice way, because I'm your psychiatrist, and this is not professional. Um, Sorry, Crew is on the bed. He had a little neck scratch. Okay. Um, So I guess that I just want to start this out. Number one, we need to go over. She also, in her story, has a therapist, and according to her, the therapist also has attached themselves to her, and is just would not let her go. Did not want to let her go as a patient. And then she also talks about a boyfriend who, um, attached himself to her and won't let her go. I mean, in this lady's life, basically, I mean, it seems to me like she has issues. She's got some narcissistic personality disorder traits. Um, Most definitely, but seriously, I mean, I think that she has. I think she needs inpatient therapy. To be honest with you, um, but I truly, honestly hope that this psychiatrist, this therapist, and anyone else who was involved in the story that she mentioned. I hope that they've actually sought restraining orders from her, because I fear that she may. And now, this again, this is just my opinion. This is for educational and entertainment purposes only. Um, I feel that if she's pushed, that she could hurt someone. So I really hope that they've sought protection from her. But let's just first of all, I want to talk about what these different, in a therapeutic sense, what a psychiatrist is, what they do, what a therapist is, what they do, and what a psychologist is and what they do. Okay. Because if you listen to her story, it's very easy to tell that, number one, you can tell that she is very much making up a lot of this. She is, don't start barking at the trash man. Hold, please. Okay, let's see if that was enough time for him to get over. He barks at anything that makes noise. He thinks that anything that is outside the house is trying to come in and it's going to take us all the way up to a spaceship. I don't know. He's my doggy. He's my baby. He's my protector. So that's just the way it is. But anyway, because like I was saying, um, you can tell that she is stretching the truth, that she is making things up simply because of the fact that you can tell that she does not have a true understanding of what each one of these mental health, professionals, the role that they play for her in her life or any other patient's life. So let's start out with a psychiatrist, okay? A psychiatrist is actually a medical doctor. They can prescribe medications. They specialize in mental health. They evaluate, diagnose, and treat mental and emotional behavioral disorders. Um, and they do that through, conducting assessments, which determine certain, mental health conditions, such as depression, anxiety, maybe even schizophrenia in this case, because her chat also seems to have different names at different times. One time it's Henry, next time it's Claude, who knows. Um, they also develop and implement treatment plans, such as things like psychotherapy, which includes like talk therapy, cognitive therapy, behavioral therapy. They prescribe medication and manage those medications. And if they feel that you need to be hospitalized, they can do that, and they can intervene as necessary. Um, they monitor patients' progress and adjust their treatments. As the patients are progressing, um, they work with the therapist, social workers, primary care physicians, anyone who's in that person's treatment plan, to provide that care. But I think it's the whole thing. We've always watched movies where the lady goes to a psychiatrist and she walks in and lays down on a couch and tells her life story, and the psychiatrist gives a few, tells her a little, um, gives her some affirming uh, words, and all of a sudden, the lady's life's changed. Okay, that's not the way it works. That's not what the psychiatrist does. But the psychiatrist does work with therapists, social workers, or primary care physicians to help. They conduct, like I said, the assessments and things of that nature. Um, Now, and again, remember, they are a medical doctor, they're an MD. Now, let's talk about a therapist. They too are are a mental health professional. Okay, crew, come on. Um, Now they also, they usually hold a master's degree, and their focus is more on therapy and counseling. They help modify behaviors to improve overall mental health. They do, help with the assessment and the diagnosis. Um, let's see, what else do they do? They are a key player in the treatment plans. Um, whether it's through things like techniques like exposure therapy, cognitive restructuring. They teach coping skills, to equip clients with um, practical strategies to manage challenging situations like stress, anxiety, or depression. Um, they provide support and guidance, for the patients or the clients. Um, that by and they do that by, they provide that safe space for clients to work through um, any problems that they're having, to work towards that positive change that they're looking for in their life. Um, they also, encouraging clients to, keep them focusing on the present so that they don't, revert back to past experiences, past behaviors. Okay. Now they cannot provide medication. As I said, they work with psychiatrists with the assessment, diagnosis, evaluations, things like that. They are part of the treatment plan. Okay. Now there's the next would be, let's look at a psychologist. Now, a psychologist, they study human behavior. So research is a huge part of what they do. Um, they do study the treatment of emotional and behavioral, disorders. Um, but most of their work is focused on research and, possibly, um, they work in different types. Like you have a clinical psychology, counseling psychology, educational psychology, organizational psychology. It's a range of services. Um, and it's really from therapy and assessment to the research and education. But they study the human psyche. Okay. They most of the time they have a PhD or a PSYD, psych degree. Um, but and you a lot of the times you can go if you've been required, say, for some type of a lot of people when they're going through divorces and there's child custody involved, um, they will want to have a psych eval done on both the parents. A lot of the times you will end up going to a psychologist and they will give you that assessment. Um, but and they can be a part of your treatment, but for the most part you're going to be dealing with a therapist and a psychiatrist. However, I mean, it's very clear in Kendra's case that, I mean, that's how you can kind of tell that a lot of this, what she's saying, I don't know how many parts there are to her TikTok story, but she paints herself as the victim, and she paints the psychiatrist and the therapist as the predators. And that's really not the case. In this case, she very much is the predator. Um, and she is hyper focused on the attention of the psychiatrist, the therapist she's seeing, and apparently anyone else in her life. Um, it's clear that she's got issues. Um, and I'm terrified. I mean, that's just, yeah. And this whole Chat GPT, her Henry, as she calls him, I mean, like I said, she's got her Chat GPT set up to only give her positive affirmations, which means that everything she's getting from this thing is only positive. It's not even reflecting at all on what's really going on. On top of the fact that, it's Chat GPT, people. It's not a psychiatrist. It's not a therapist. It's never been to school. It's literally taking a bunch of garbly and putting it together. And this person who is mentally ill is asking it questions, and it's telling her. And then she goes into tarot card reading and just, I mean, it's a mess. It really is. Like, I'm really wondering, this is what I'm left with. Was she doing all of this just as a work? In other words, was she doing this whole thing as some kind of theatrical piece? Um, thinking that she's going to get some type of notoriety for it and be asked to, I don't know, or the only other option is this woman is really got some issues and she really does need help. I mean, she needs some inpatient help, in my opinion, anyway, because, like I said, I hope that if this is real and this is really her, what's going on in her head, I really, really hope that the psychiatrist in this situation and the therapist um, have taken the proper steps to, you know, to do what they can to be protected from her. Um, she took an email that, she quit going. She quit going to the therapist. Okay, because again, to her, she said that the therapist was doesn't understand boundaries and was attached to her and did not want her to leave as a patient. Well, no, they don't want you to leave as a patient. Why? Because they know that you still need help. And she was talking about how she quit her therapist, and 2 weeks later she received an email from the therapist, asking her to come back for one last session to wrap things up. And she was, saying, "Oh, see, this proves it right here. See, she couldn't go 2 weeks without me being there. She's just attached to me." Unreal. Um, no, that's a therapist who genuinely has been talking with your psychiatrist, and between the two of them, they both agree that you need to get back into therapy because you're not well. And she talks about the haters jumping online, and then she talks about how, oh, she now has this big group of, and she has wonderful mods. But in the next sentence says, "If you would like to be one of my mods, please contact me." No, she doesn't have mods. I mean, she might have one or two, but these are not people that are there to help her. Because if you're, from what I've genuinely seen, is people actually in the comment section, being real with her and saying, "No, this is in your head. You're reading all of this wrong." And number one, I mean, your psychiatrist is there to manage your medication. He works with your therapist. The therapist is the one that you are supposed to be telling all this stuff to. The reason that your psychiatrist acts the way that he does when you plop your butt down in his chair and proceed to tell him about all the dreams that you've been having about when you're ovulating and you're having sex with him in his office, the reason that he acts ice cold, that's not because he's listening to you and he's having to act ice cold because, you know, that boundary, but he's leaving that door open. He's allowing you to talk that way. He's being ice cold because, I mean, he's there to manage your medication. He's not there to listen to all that. Um, he's assessed you, he's done his assessments, or he's worked with your therapist to do your assessments, and he's there to manage your medication. That's why the first thing that he asks you, have you had any thoughts of harming yourself? Have you had any thoughts of harming anyone else in your life? That's why those are the questions that he asks you. She talks about how in the beginning her appointments were through the telehealth, over the phone, and how she just, knew that he was in love with her too. And so she just had to go and she had to do a face to face appointment, and then was upset when she walked into his office and all he did was give her a little pat on the back. And oh, there it is right there. There's that door. See, he gave me that little pat on the back because he knew that he couldn't touch me anywhere else. And it was just sick. It really was. I mean, this is a sick woman. and then quitting the therapist and the therapist emailing her, and she saw that as stepping over boundaries because she wants me to come back so bad because she has attachments to me. No, it's because your therapist and your psychiatrist have been talking, and they both see that you are spiraling and that you need help. That's why she emailed you. But as I said, I mean, it's clear that, this woman has no idea. I don't know. Like I said, I have to look at it one or two ways. Either this is someone who is trying to break into um, acting and is using this as some kind of theatrical work to, for her portfolio, or she needs inpatient therapy. I mean, that's that, because no one is. I don't think anybody in her life, especially if you've rejected her in any way, is safe, because yeah, unhealthy attachments should be her. I don't know what her last name is, but it should be Kendra Unhealthy Attachments, whatever her last name is, and Henry. Um, you know, the Chat GPT is so bad. It is not good at all. Okay. We don't need to be using it, and especially people who have psychiatric disorders, mental issues, behavioral, emotional, whatever. No, you need to be talking to a real person. Get you a real therapist. But anyway, yeah, I just had to hit that because that just, I got my youngest up this morning and got him off to school, and so I was just sitting here drinking my coffee, and that came up. And I was like, "Oh, okay, well, I hadn't heard about this, so I watched one video on it, and then all of a sudden I see everything else that's popping up about it. And so this is blowing up everywhere. And I'm looking at this woman going, oh my gosh, she needs help. So I just hope she gets the help that if this is real, either, like I said, either she's, and she's doing a pretty good job. If she is doing it as a theatrical work, hey, kudos to you. Bravo. Chef's kiss. If not, oh goodness, yeah, I hope that the people involved that she's talking about in here have taken the proper steps to get, to be safe from her. All right, guys. Well, I'm gonna get off here for a little while. I'm sure I'll be back on later, but who knows? Let's see where this develops, or if it develops at all. But if nothing less, get a little education about who does what and when and how that works. So, all right, guys, y'all have fun, be safe, and always know that you're loved. Love you guys. Bye.